Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today we want to talk about the proper technique for relining a lower or upper denture using the Shatkin F.I.R.S.T hard reline material. This is a new and improved material that we came out with, and this product is really great because it sets up very nicely. It almost always picks up all of the housings, which we had a little bit of an issue with the old material where occasionally one or two housings wouldn't get picked up with the material. So this stuff is really nice. Okay, it sets up very strong, very hard, and it bonds to the base of the denture much better than the old material also. The old material we used to recommend putting a bonding agent on the denture. We don't need to do that with this. All we do is roughen the denture and it will bond very nicely. Okay, so this is the Shatkin F.I.R.S.T hard reline material, and it's a pink material, and it comes in the tube, the mixing tube. So you just put it in your auto mix gun cartridge with the pink tip on it, and we also include some pens to mark the locations in the tissue before your surgery, and a ruler to measure the vertical and all kinds of different things for your reline. So that's the Shatkin F.I.R.S.T hard reline kit. The question then is, how do we do a reline? First and foremost, when you put the housings on your implants, make sure you put the blockout shims on first. The blockout shims are the little clear shims that you slide over the square part of the implant so that none of the acrylic gets underneath the housing. So put the little shims on, snap the housings on over the top of that, make sure they're snapped on all the way. Try your denture in and make sure it seats passively over those housings, very passively. In other words, the housings are not going to hold up the denture at all. You want it to seat passively. If it's held up at all, grind out some more of the denture and try it again. Make sure it's seating passively over those implants and housings. The denture should go all the way down, and the patient should be able to bite together, and the occlusion should be right on, and all of that before you go to reline it, okay? So you've got your shims, your housings, you've tried in your denture, and made sure that it seats passively. Once you've confirmed that, take the denture out, make sure it's a little rough, because that's how this hard reline attaches to it if it's rough. If it's a polished denture, it will not attach well. So you want to roughen it a little bit. If you're extending it to the distal aspect of the denture, you want to make sure you want to roughen the distal portion of the denture as well. Okay, so make sure you, the retromolar pad or wherever you're going to reline, make sure that's rough. If you don't want to reline that area, do not roughen it. Leave it polished, and then that material will just flake right off. Okay, but if you're relining the entire denture, wherever you roughen the denture, that acrylic will stick very firmly. Okay, now dry the internal of the denture very well. Next thing, take your gun and just dispense that reline into the denture, and it's okay to have it overflow a little bit. You'd rather have a little more than not enough. You can always trim it away and polish it. So you put it in the patient's mouth for 5 minutes, have them bite for 5 minutes. Set a timer. We have timers in every operatory with our clocks. You can do it on your watch or your phone or whatever. But set a timer for 5 minutes, have the patient bite together and hold it for 5 minutes. Now make sure your assistant's watching, because patients have a tendency to open their mouth, fall asleep, all kinds of things can happen, and then the bite will be off. So make sure they're biting and holding it for 5 minutes. Have your assistant, I have my assistant just hold the chin there for 5 minutes. After 5 minutes, you should be able to snap the denture right out. All the housings will come out with the denture, just like this. And you'll just trim away any excess acrylic around the housings and around the periphery of the denture and polish the denture up, and then it's good to go. Snap it in. Okay? Now the most important thing is that the patient continue to wear the denture for the first 24 to 48 hours. That is critical, because if you don't do that, the tissue will grow up around the housings, because what happens is they get this histamine reaction in the first 24 to 48 hours after having the procedure done. So the denture what it is, it acts as a Band-Aid and it keeps that tissue down. If the patient goes home and takes the denture out, falls asleep, they're going to wake up the next morning with tissue surrounding the balls and squares of the implants. And then it's a hassle because you have to get them back in, you have to laser that tissue away, and then put the denture back in. But if they keep it in for 24 to 48 hours without removing it, that will not happen. So that's very, very important. If I do the procedure on a Friday, I normally won't see the patient till Monday. That's 72 hours. I say leave the denture in all weekend. I'll see you Monday. Do not take it out. If they listen to you, everything's going to be great on Monday. If they didn't listen to you, you're going to have a headache on your hands. So that's the key to having a successful reline of a denture. I'm Dr. Todd Shatkin, and thanks for listening on this Monday Morning Minute.
So Len, can you tell us exactly what's going to be going on in this new advanced course?
Yeah, so, just like you said, we've actually rehauled this entire course. All right, It's something brand new that we're doing, and we're going to be starting off the course on that Thursday. We're going to be doing case planning. All right, so every single one of our doctors, we're going to be case planning their own cases. All right, we're going to have patients lined up for you guys, but you guys are actually going to plan what size implants to place, where to place them, what restoration we're going to use, and it's going to give you guys a chance to do what Dr. Shatkin's doing for each and every one of you guys. But we think it's important that you guys know the case planning process. That way we're all on the same page when we're doing these restorations.
Right. And we're going to, along those lines, we're going to talk about lab times. We're going to talk about everything we need from you from the office. Mm-hmm. So we're just going to make sure that everybody's on the same page about what we're going to be doing. If you're doing a cemented roundhouse, if you're doing a fixed on 6, if you're doing a single tooth, or you're doing some type of over denture stabilization. So it's going to be awesome. I think it's going to be very helpful for everyone involved. And
these are the questions we get every single day, So
yeah.
Pretty much what we did when we came up with this new course is we looked at the list of questions that our doctors sent us, the most common issues that our doctors are having, and we want to be able to address that for you guys. So that's why we've changed out the structure of the course.
That's right, and a lot of the questions, thank you very much for sending them in. We appreciate it. We got overflowed with questions, and it's good because we went over Dr. Shatkin, myself, Rob, and Lenny, we were going over the list, and it's amazing how many questions we're sending. So thank you very much for that. It's going to be 3 awesome days. If you've been placing mini dental implants and you want problem-solving techniques, you have to show up. You'll be happy that you did. And we have a few seats left, right?
We do have a few seats left.
Quick.
Just like I've said in past Monday Morning Minutes, this is one of our most highly anticipated courses of the year. We're only doing this twice this year. We're doing it in March and we're doing it again in November. All right, but we highly encourage you guys come out now. That way you have the rest of 2024. You have all this knowledge, all these tools that you're going to be learning here in March to use throughout the year. So it's filling up. I mean, we have a few spots left. If you guys are interested in attending, either give myself, Fitz, or any of the guys here a call at Shatkin F.I.R.S.T. We're offering you guys a special discount. All 3 days, we're taking $300 off, and if you guys give us a call, we'll take an additional $200 off just so we fill up the course, those extra couple spots.
Absolutely. That's what a deal. What a deal. That's awesome. And remember, to find the best mini dental implant, some people call them small diameter implants, whatever you want to call it, it's the best in the world. The Interlock Shatkin mini dental implant, our mono implants are phenomenal. So come out here, learn how to place them, and we'll look forward to seeing each and every one of you in Buffalo on the 21st, 22nd, and 23rd of March. Have a great week. You have anything else to say, buddy?
That's it. We're looking forward to seeing each and every one of you guys here in March, okay?
And have an awesome week placing mini and mono implants. Look forward to seeing you on next week's Monday Morning Minute.